Serving all of San Diego, this is your Fox 5 News.
Okay, well, many things can influence one's sex drive, and there are things that you might not have thought of, like smoking and attention deficit disorder. So this morning we have Dr. Irwin Goldstein, the editor-in-chief of the Journal of Sexual Medicine, and Dr. Rose Hartzell, and she's from San Diego Sexual Medicine at Alvarado Hospital, and they're here to break down the findings. Morning, guys.
Hi, Ali. Thank you so much for doing this. Always, Fox 5 is so generous with education in our field of sexual medicine. We really appreciate it.
Oh, of course, of course. I mean, it's important stuff. You know, I think a lot of couples out there, sex is a huge part of keeping a relationship healthy, right? I would think and assume.
Very much so.
We would definitely want to learn about this stuff. So I guess let's start with ADHD.
Please.
How does this affect one's sex drive?
Well, so there's 3% of people have ADHD, and that's 10 million people have ADHD.
Wow.
And the dilemma is they can't stay focused.
Right.
When we get sexually aroused, if you watch sex scenes on cinema, you know, you get the adrenaline pumping, your heart is beating, you're breathing fast, you're really focused on having sex. And these poor people with ADHD, they're thinking about food, the weather, the Padres, the whatever, and they just, the laundry, they just can't do it. It's just a brain chemical problem.
I can imagine that wouldn't be a good thing if a couple were intimate and the woman's like, I wonder what's going on with my laundry. I can imagine that would ruin the mood a little bit. So yeah, I mean, what can someone do, I guess, if they have that issue?
Well, some relationship tips that couples can use to help with ADHD is to set aside time for intimacy, get all the distractions off. So if the TV's on, turn it off. Have your partner write things in a planner, make lists so they can kind of set those aside. One really huge thing that couples can do, or the person with ADHD, is go to yoga, which can also help with flexibility.
I'm a big fan of yoga. Oh, so there's multiple benefits.
Exactly. There's also mindfulness or meditation.
Oh, very
There's
cool.
2 drugs, Ritalin and Adderall.
I was just going to ask that.
Awesome for people with ADHD. They have great sex on these drugs.
Really?
You take it 6 hours before. It's a 6-hour acting drug. So.
Oh, well, very interesting.
Good.
Well, good to know. Okay, let's talk about smoking, because I think smoking also, that seems, I could understand how that might affect, but I don't know why. Why does smoking affect one's sex drive?
So I have here a actual duplex ultrasound probe. This is a probe that if you're pregnant, you put on your tummy and you get to see the baby inside. We can place this over the genitals. So in the Journal of Sexual Medicine, there was a research study showing that in heavy smokers, women, first time ever done in women, they had far less blood flow to their genitals than control non-smokers. So we're now starting to see the sort of blood vessel constriction, blood vessel blockage effects that we've seen for many years in men. We're now finally seeing it in women. It's a very important paper and it's very important information. That's why we're so happy that you're doing this with us.
Right, so that's both men and women, though, it can affect. So
The
we knew
paper
it
is
for
about
men.
women, though, yeah.
The newest study is about showing it for women, too. Wow, that's really interesting. So I guess if you're a smoker and maybe experiencing some trouble in the bedroom, is this reversible? Can you quit smoking and will it help?
So we need tips to stop smoking. So Dr. Hartzell, tell us
First
how to stop smoking.
First off, if you aren't a smoker, don't start.
Okay. Yes.
Second, there's smoking cessation classes in the community. Get involved with that. Make a commitment to stop smoking. And then also, you're going to have to develop new coping mechanisms. A lot of times, people will start smoking as their default if something's stressing them out. So going back to yoga again, that might be a good thing to help with that as well.
Right, definitely. So if you do stop smoking, though, like that sort of how you said the blood flow decreases, it will go back up.
Sure. One of the chemicals of smoking is nicotine, which is a constrictor. So getting rid of nicotine would allow it to dilate. Basically, what we're talking about here are some sexual problems happen without your permission, without your control, like ADHD, or if you had cancer and you had to get treatment and you had sexual problems. But some of them are under your control, like smoking. I mean, you should be able to go through smoking cessation classes. There's good medicines to stop. Chantix is a drug you can take to stop smoking. There's nicotine gum. There's all kinds of things. But it seems so silly to bring it on when sexuality is so important. Why would you take something that would interfere?
Right. So, I mean, not only is it bad for your health, but it's bad for your sex drive. So another reason to quit smoking. Well, guys, thank you so much for being here. And if you at home want to reach Dr. Goldstein and Dr. Hartzell, you can just go to our website and click on the CNN tab. All right, Raul, over to you.
Smoking's bad for you.
It's bad. Don't smoke.
Smoking's bad for you. The doctors always say that. Thank you guys very much. Good info as always.